are back on the record at 2:34 p.m.
All set?
Yes, you are.
On May 21st, 2012, you got a call from Dr. Page, true?
Yes.
And Angel Milam, when it was in his office with him when he spoke with you.
I don't know that.
You don't?
No.
You recall that Dr. Page went over his findings with you, true?
He said I'm sending her to the hospital for delivery. I don't remember him going over findings.
Okay.
I don't remember all that, to be honest.
Do you remember him recommending to you that Angel Milam be admitted for delivery?
Right.
Yes.
Yes.
And that she will need intrapartum AZT therapy.
Yes.
True? He told you that as well?
Yes.
He told you that Angel Milam required continuous fetal monitoring. True?
I don't know if you mentioned that. It was very brief, the
Yes, ma'am.
conversation. HIV for delivery, his fetal assessment was showing that she needed to be delivered today. There wasn't much detail with the conversation because he said he was sending a report over.
Okay. And where were you when you were on the phone with him?
I don't even remember.
Okay. Were you in your office?
Don't remember.
Okay, and he sent his report over?
How soon, I don't know, but I'm sure he did because it was on the hospital chart.
So do you remember about what time that call was?
No,
Was that on your mobile number, the number you shared with us earlier?
I'm not sure if he
Okay.
called the office or the mobile.
All right. Did Dr. Page tell you that he recommended a cesarean delivery?
I can't remember that,
Okay.
but probably that would have been told.
Yes, ma'am.
Makes sense.
And that he recommended that the patient advised to follow NPO?
He would not have told me that because I'm the surgeon, he's not.
Got it. Okay. You would have just known that if you were going to do surgery, a C-section.
If I was going to do something once I assessed her. He told me she needs to go in for evaluation.
Okay. Follow newborn HIV protocol, he told you that?
He just said AZT, yeah.
Okay. And that is the
Yeah.
protocol. What else do you recall Dr. Page telling you in that telephone conversation regarding
Not
Angel
much.
Milam?
2.5 years later, not much.
Okay. Anything else that you recall that you haven't shared with me already?
Nope.
Okay. And when did you refer Angel Milam to Dr. Page?
Don't remember that either.
Do you know whether it was that day or?
What day?
May 21st, 2012.
Oh, he was involved before that.
Okay.
Yeah, I think you stated earlier that I send patients to him, so she came to my office April 23rd. I'm sure by routine, she would have been referred to him.
Okay, so you routinely referred patients to Dr. Page?
He, Dr. Boots Taylor, and
Okay. Are you still practicing medicine now?
right now I'm taking a hiatus.
Okay, and when did your hiatus start?
Last year, fall.
Okay, August?
Don't remember correctly, exactly.
Okay. Well, last fall, so 2013.
2013, yes.
Okay. And why did you take a hiatus?
Because I wanted to take a hiatus.
Okay.
My children are needing their mommy right now, so
Okay, all right.
divorce, option I have.
I'm sorry. that
An
last
option I have.
part. Okay. And you resigned your privileges at South Fulton Medical Center, true?
No.
You did?
The obstetric privileges were implemented to either continue at AMC Center downtown or there wouldn't be any because there were no obstetric services at the current location where I was practicing with them. So that was kind of a option whether or not I wanted to go downtown. And then the only thing remaining would have been the gynecologic privileges. Those I resigned.
Okay.
Mm-hmm.
And that was in August 2012, true?
I don't know exactly when it was. It could have been May, it could have been June, could have been, I don't know when it was.
Let's see.
You said 2012, though?
Yeah, 2012.
Okay.
Mm-hmm.
I'm going to show you what's been previously marked as, well, you make a copy. We'll mark it 10.6. This is SFMC Whyte, CRED 000052. Sorry. Ever seen that document before?
No,
No?
I didn't sign it, so no, I didn't see it.
Okay. I'll show you what's been marked as 10.7, which is SFMC Whyte, credentialing file 00053, looks like. Mark that as 10.7. Recall receiving that letter.
Yes, I do remember this.
What's the date of that letter?
August 30th.
Okay, and that letter to you said that James Clements, as CEO of Southfield Medical Center, accepted your resignation.
He wasn't the CEO.
As
Is he
Chief
the
Executive Officer.
James Clemens. I thought you said James Fremont. But
I'm
yes,
sorry.
I thought you said James Fremont. I'm sorry.
Okay.
Accepted, yeah. So it looks like I resigned and they accepted it.
All right. And why did you resign?
Because I wanted to be at one hospital. And if in the beginning I could have started at one hospital, I would have.
Okay.
Because I have more obligations at two hospitals.
Okay. No one ever suggested to you
No,
to resign
no,
or anything
no.
like that? You mentioned you've got a copy of the South Fulton Medical Center record for the 21st and 22nd of May 2012. And I believe you mentioned that Angel Mullen signed something refusing an autopsy. Can you show me that?
If it's not in there, I don't know where it would be because I really don't know.
Where's that other?
Can't account for what's not there. I just know I signed it with her.
You just know what? I'm sorry.
I know I signed it with her, so whether it's there or not,
Okay. You don't know whether you could find that?
I think they're looking.
There you go. Have a look. For the record, you're looking at Exhibit 10.
Jim, you're just asking her to look through the chart and see if she can find this refusal form.
Yeah.
Okay. Jim, if you know it's not in there, why don't you just represent to her that you've inspected the chart and it's not there, and have her comment on that if that's what you're
I
looking
think she's
for.
nearly through with it.
Okay.
Thank you, though.
Well, I was just thinking of a way to.
You have more experience than I am, and your tutelage is always, I consider it quite helpful.
Thank you so much, but I'm not experienced in this particular issue. But
I'm sorry, kind tutelage is what I meant to say. I don't think so.
So it looks like it's missing.
Okay. And for the record, you went through Exhibit 10, which is the certified copy of medical record for Angel Mullen provided by South Fulton Medical
Yes.
Center. And you did not see that refusal of an autopsy in there.
I didn't see the refusal or the consent for one.
Okay, and you think that may have been, it was in the record at one time, you have no idea what happened to it?
I signed it and put it in the record. It's not in this one.
Okay, so you think this is an incomplete record? Is it? This appears to be an
If I
incomplete record.
sign one and it's not in there, then it's missing.
Okay, all right.
For the record, there may be another record for baby girl myelin or not. There's a chart for the baby and a chart for the mother. I think you showed her only the mother's chart.
I'll show you what have been marked as Exhibits 10.8 and 10.9, which are were also provided as part of the South Fulton Medical Center certified medical record for Angel Milan. And these are SFMC 0056 and 0057, which appear to be records for Reina Lopez Santos. Do you have any idea why those are in that record? This one?
I have no idea.
Okay. And what about 10.9?
No
What-
idea.
Do you know whether this the drugs that are listed here were administered to?
I have no
Angel
idea
Milan.
about this case. But this what you're showing me.
Okay. Do you think that waiver you're talking about could be in your office record?
It would never be an office record
Okay,
because it's a
just the
hospital
hospital.
record.
Yes, ma'am. Thank you.
They're separate.
All right. I'd like for you to have a look at the hospital record, whichever one you want. We're going to go through the labor and delivery flow sheets. All right. You start at
137 again?
correct. And that set has been marked as 10.5. If you see here at, let's see, 1630, the 1630, the fetal heart rate, baseline rate is 130. Isn't that true?
Yes.
And that would indicate to you, according to the hospital record, Angel Milan's fetus, the baby was very much alive at that time. True?
I just stated earlier
Yes,
that
ma'am.
that's an external fetal monitor, and it would indicate that before the surgery was done, but afterwards we see that it was faulty.
Okay.
So therefore we saw its error
Yes,
in
ma'am.
being an external test.
So the equipment at South Fulton Medical Center, the fetal heart monitor was somehow picking up a fetal heart rate, a baseline rate of 130 when there was no heart rate. Is that
That's what it looks like.
all right? And then at 1700, which is 5 o'clock, also the record indicates fetal heart rate, baseline rate of 130. Is that right?
That's what it says.
And you would, in your view, the baby was, of course, already dead at that time, so that's also due to faulty equipment,
No,
Sure.
it's not faulty equipment.
faulty interpretation by,
I didn't say faulty. Those are your words?
okay, well, give me your words.
Okay. The external fetal monitor
Yes, ma'am?
is an external fetal monitor,
Right,
so it's not 100% accurate.
okay.
Those are my words.
How inaccurate is it?
It could be anywhere from 5 to 10% inaccurate
Okay,
or more.
okay.
With a body habitus like hers and everything else that was going on, the point that it's inaccurate, and there's any percentage of inaccuracy.
So where does that fetal heart rate of 130 at 1630, 1700, and 1730 on SFMC 0137 come from?
I can't comment on that.
You have no idea
I can't comment on that.
because you don't know.
Exactly.
Okay. If you would turn on over to the next page, 138. At 1800, now we're up to, that's equivalent, let's see. Well, 1622, again, there's a fetal baseline heart rate of 130, true?
I'm sorry, I don't see where you are. I see
sorry.
1630 and
I see
1633.
1622.
1730? That's what you're pointing to?
Are you on page 137?
Oh, you went back? Okay. You already on 137.
Hold on.
You flipped the page.
Yeah, 137.
Okay.
Yeah. At 1622, the fetal heart rate, baseline rate was 130, true?
Yes, that's
With
what they have
minim-
recorded.
I'm sorry.
It's recorded.
Yes,
It's
ma'am.
130.
It's also recorded minimal, undetectable to less than 5 beats per minute, true?
That's
And
written
that's
here.
Category 2 strip, right?
That's written here as well.
Okay. And do you have the strips there?
Yeah.
The strips. both of them. Oh, sorry.
Don't get a paper cut.
Mark these as 10.11, 10.12. Oh, you have them? And you're
Yes.
looking at the electronic for 10.11, that's the fetal heart strip for Angel Mylan. True?
I'm sorry,
Look
what did
at
you
it.
just ask again?
That's the Mylan, Angel Mylan for Dr.
Yes.
Whyte, the fetal monitoring strip. True?
Yes.
And then we've also got 10.12, which is South Fulton Medical Center QS 0662 to 0729, which is the electronic version, right? I think that looks like that's what you're
what it
looking
looks
at.
like, yes.
And
Let me
the,
just see that.
sure,
Mhm.
yeah, you can look at whatever you,
Okay.
and the electronic version is the one it appears you're looking at, right?
Yes.
The stored strip, right?
Right.
And these are the same, right? The pagination may be different,
That's what
but
they're supposed to be, yes.
okay. If you look at the fetal monitoring strip for 0662,
Oh, that's not in here. You just have it, okay.
it's,
No,
I think
that's
it's
okay.
right there. Or,
No, this doesn't, this goes up to 04.
that predates this visit, I think.
Okay.
No, you're welcome to
So
use
where's it
mine.
go? Oh,
You,
just
you need to
use it.
look at 662. Do you have the strips for May, Paul?
May, what is this?
These are April, so I need May. And
It
this-
says April 29?
Yes, ma'am.
Okay,
Let's see.
so that's not May.
Yeah, it starts here then.
Here's May.
Okay, let me do this one.
Okay, starts, looks like on 665, May 21st,
Okay.
exhibit 10.12.
Okay. Okay.
If you flip on over to, you see the time up here in the upper right corner?
331?
Yeah, do you see, which one are you looking at?
0666?
Okay. 0666. That's 15:31 or 3:31 that afternoon, right?
Yes.
And you don't remember the exact time you got the call from Dr. Page, right?
No.
But that would have been, what, within? An hour or two? Any way of knowing? Do
I don't know.
you have your phone records for that month?
Probably not.
Who's your,
I don't keep phone records.
I understand. Who's your carrier for your mobile?
Right now it's T-Mobile.
Was it T-Mobile then?
No.
Who was it then?
I'm not sure if it was Verizon or who.
What was your number then?
Same.
Okay. So can you, if you look at 0666, do you see any fetal heart rate there?
Oh, no, they were just trying to get it on.
Okay.
No.
Flipping on over to the next page, 667, 668. When's the first strip where you see a fetal heart rate for Angel Mylan's baby?
A little one, 0672.
Okay.
Just that little column, kind of.
Yes, ma'am. Over here.
More so 0673.
Okay, and 0673, how would you categorize that strip?
You can't because it's not continuous. So far, you just say looks like there's some kind of heartbeat.
Okay, what's the baseline fetal heart
Looks
rate?
like 130s.
130s?
Mhm.
Yes. Yes, was that yes?
Yes.
Okay.
Yes.
And then 674,
You can't comment on that.
can you categorize that strip, 674?
No.
What's the baseline heart rate there?
Can't comment on it.
Okay, what about the variability?
Can't comment on it.
Okay, why is that?
If you can't see it and it's not continuous, you can't comment on it.
Okay, so 673, 674, 675, is that not continuous enough to comment on? So you can't categorize that as category 1, category 2, or category 3, true?
Continuous strip.
Okay.
Continuous strip.
But I need to get,
20 minutes.
you can't categorize
No.
that as category 1, category 2, or category 3, true?
Nope. True.
Okay. 676. Turn on over. Category 1, Category 2, Category 3. Can't categorize.
That one's a category 2
Okay. And it's Category 2. Why?
because there are no accelerations.
Okay. And what's the variability?
It looks average.
Moderate? Okay.
Average.
And is this, looking at the strip at 0676, would that indicate to you that that baby's dead or alive?
Dead or alive, I would not comment because, of course, beforehand we would assume it's alive.
Yes, ma'am. But now you know that the baby was dead as of this time.
Right.
So as of this strip, 0676, 5/21/2012 at
1655.
16:55, which is 4:55, close to 5 o'clock. Angel Mylan's baby's already dead at that time, true?
From the intraoperative findings of a skull or any kind of bony structure being soft as a sponge,
Yes, ma'am.
it would have been dead by then.
Yes, ma'am.
It's not an acute finding.
Okay, same thing on 0677. Angel Mylan's baby's already dead then.
Same reasoning.
And that's,
Same reasoning.
Yes, ma'am. And that's a yes, right? Yes for the same reasoning?
And when you ask me that, you're asking me that like I knew that at the time of the course this was going
No,
on?
ma'am.
Okay.
No, ma'am.
So then the answer would be yes to everything because the intraoperative findings told me the baby was dead.
Okay.
And it was not acute. So it would be yes, yes,
Okay.
yes.
Okay, so for the entire strip, which we've marked as Plaintiff's Exhibit 10.12, throughout this strip, Angel Mylan's baby's already dead,
That's
true?
what it looked like.
Yes?
True.
Okay. And looking at 677, can you categorize this strip?
It looks like she needs a fluid challenge because the B2B variability is not as good. So,
Okay.
yeah.
Now, you never saw any of these strips until the 22nd, true?
I didn't see them all the 22nd either. I mean, I would have had to go back and look at everything.
Okay, when was the first time you saw the strips?
I don't remember. It's been a minute. I don't remember.
After you'd already delivered the baby and the baby was dead?
Possibly, because there was such an urgency when
Yes,
I
ma'am.
came. So I'm sure I wouldn't have taken time up to go back and look at a multiple array of strips
Yes, ma'am.
when there was an emergency at the time.
Now, if you'd gone to the hospital on May 21st, 2012, the strips would have been available to you, true?
They wouldn't have been there because they would have been forming. She
Right.
was admitted on May 21st.
Right.
So we would have been getting some recordings.
Okay. And you would categorize the strip SFMC 0677 as a Category 2, you said?
Like a 3, 2, 3.
Category 2 or Category 3, right?
Yeah, just
Yes?
2, 2, 3, 2. It didn't have any D cells. The variability does look minimal, but sometimes the fetus can be sleeping. I mean, we
Okay.
can't just look at this one little, what is this? 1, 2, 3, 4, 5, less than 10-minute strip and make a decision
Well,
like
but we've
that.
been looking at strips for,
Well, then, okay, then I would not be just using 0677. I would be using some of these back here as well, right?
okay.
Okay.
And you would categorize the strip at this point as,
Maybe fetal sleeping or either category 3.
okay, Category 3 or fetal sleeping, true?
Mhm.
Yes?
Yes.
Right. And this is, there's minimal variability here, you would agree with that?
Yes, right. That's why I would be sleeping.
All right, then 678, Category 1, 2, or 3,
2.
okay. 679,
3.
and the baseline,
Variability is decreased from the
Okay.
previous page.
and the baseline heart rate is what?
130s.
Okay. 680, Category
3.
baseline,
The decreased variability, and now we see like a little variable, which may not be anything. The baby could have just tangled on its cord.
yes, ma'am.
But of course, we're looking.
Okay. And if you look at the labor and delivery flow sheet for that same time, 1728, which is going to be
I don't think it's back.
It is.
Might be in between here. Yeah. Let's just see.
1730 on page SFMC 0138. You see that?
Yes.
Okay.
I saw it.
And how did the nurses classify that Category 3 strip? Looks like they classified it as a
Well-
Category 2, true?
Well, we're not, once again, this is kind of like a subjective, objective kind of thing. There's no real hardcore with this because there's no accelerations. The Category 1 is more of a definite response, but this is kind of in between, you know.
Did any nurse
could
from
say 2 or
Southfield
3.
Medical Center on May 21st or May 22nd, 2012, ever tell you that Angel Mylan's baby had a Category 3 strip?
I don't remember that. I don't recall.
Okay, I didn't see that anywhere in the record.
Okay.
Did you?
No.
No.
I don't
If you've got a patient in the hospital with a baby and it's a Category strip, don't you expect those nurses to tell you that they're looking at a Category strip since you can't see it?
Category 3 is what you mean?
What?
You left out the 3.
Category 3 strip.
You said object.
You can answer.
Oh, yeah. Yeah.
Okay, I'll ask it again. So, if you've got a patient in the hospital and you're not in the hospital and you're relying on those nurses to tell you what's going on with that patient, true?
Yes.
And if that patient is 36 weeks, 6 days, and has a Category 3 strip, you would expect those nurses to tell you that patient has a Category 3 strip, true?
If it's a Category 3, yeah.
That's something you would want to know.
Mm-hmm.
Yes?
Yes.
And if it's a Category 3 strip, you would go to the hospital, true?
With other yes. If it's
Okay. If it's Category 3 strip,
there policies set in place.
yes, ma'am.
Yeah, for Category 3 because we know that it's an external fetal monitor. Once again, that's not 100% accurate. So there are fluid challenges we give. There's the left lateral positioning we perform with the patient. There's oxygen by face mask. And then if we don't see any significant or any improvement, then we know it's a true Category 3. Because these don't look like an obvious Category 3. Obvious Category 3s would be a variable for 10 to 20 minutes or down to, severe bradycardia, down to 90 beats per minute. None of this is on here.
Well, we'll keep going.
Okay.
The Southfield Medical Center policies and procedures require a physician evaluation of a mother with a fetus and a Category 3 strip, true?
Yeah, once everything's been taken and it's a true Category 3.
Okay. And if you flip on over to SFMCQS 0681, how would you categorize that strip?
I think we can only read the first part of that because the latter part of it, which may be what you're looking at, it's a discontinuation of the heart rate, so we don't really know what happened there.
Well, this is a 9-minute strip, and it discontinues for about 20 seconds between 8 and 9.
But during that time, it's significant because it looked as if the heart rate was going down. But you can't comment because there's no continuation.
Well,
but the variability does look a little decreased.
A little decreased? A
it
lot
looks
decreased, right?
It looks decreased, but it's not a flat line. I mean, we usually can see a flat line.
You're looking at 681?
Mm-hmm. Mm-hmm.
Okay.
And
Would you
it does look decreased.
How would you categorize this strip? 1, 2, or 3, or you can't categorize
3.
it? Okay.
But then, you take the measures that I mentioned before with the oxygen and fluids and see what's
Six-
going on.
682 categorized as a 1, 2, or 3?
Oh, can't. There's no continuous heart rate there.
Okay. 683 categorized as a 1, 2, or 3?
That one's somewhere between 2 and 3.
Okay. Well, would you categorize it as a 2 or 3?
2.
Okay. 684, you'd categorize that as a 2 or 3?
Can't comment.
Okay. 685, categorized as a 2 or 3?
Can't comment. The heart rate's discontinuous.
686,
The same.
can't tell.
Right. Mhm.
687,
The
can't tell.
same, yeah.
688, can't tell.
Yes, can't tell.
Okay.
Oh, sorry.
And when you can't tell, not only can you not tell what the fetal heart rate baseline is, you can't tell what the variability is, you can't tell whether they're accelerations, what those accelerations are like, whether they're decelerations, and whether those are prolonged. True?
Objects to the form.
You may answer.
Yes.
You can answer.
Yes.
Okay. Going on to 690, how would you categorize that strip? 1, 2, 3, can't categorize it.
A 3.
Okay. 691, 1, 2, 3, can't categorize it.
2.
Okay. 692, 1, 2, 3, can't categorize it.
Between 2 and 3.
Okay. 693, 1, 2, 3, can't categorize it.
2.
694, 1, 2, 3, can't categorize it.
Maybe some subtle lates there, so. It's kind of hard. I'll have to see more of the heart rate because I kind of.
Okay. If category 3 strip is not a reassuring strip, true? It's not a reassuring strip,
Right.
true? Category 2 is not a reassuring strip either, true?
Right. It's not as worrisome.
Right. Not as ominous as a category 3, true?
Right.
Category 3 strip is ominous, true?
Usually, if the other factors don't correct it, because like I was saying, it could be just needing some more fluids, oxygen, or just repositioning of the mommy.
Okay.
Mommy's uterus might be lying on the vessel.
All right. 695, category 1, 2, 3, can't categorize it.
Can't categorize.
696, 1, 2, 3, can't categorize
Can't
it.
categorize.
697, 1, 2, 3, can't categorize it.
Can't categorize.
698, 1, 2, 3, can't categorize it.
Can't categorize.
And for all these that you can't categorize, you don't know what the fetal heart rate baseline is, you don't know what the variability is, you don't know about accelerations, decelerations, and whether the decels are prolonged. True?
True.
Going on to 699, can't categorize it.
Can't
True.
categorize.
What?
Can't categorize.
Yes, ma'am. 699?
Yes.
Yes. 700, can't categorize it. True.
Yes, can't categorize.
701, cannot categorize it. True.
True.
703, cannot categorize it. True.
True.
704, cannot categorize it. True.
True.
705, cannot categorize it. True. 706, cannot categorize it. True. 707, cannot categorize it. True.
True.
708, cannot categorize it. True.
True.
709, cannot categorize it. True.
True.
710, cannot categorize it. True.
Yes.
711, cannot categorize it. True.
Right.
712, cannot categorize it. True.
Yes.
And that brings us up to 2157, is that right? Which is 9:57,
Yes.
close to 10 o'clock that night. 713, cannot categorize it. True.
Yes.
714, cannot categorize it. True.
Yes.
715, cannot categorize it. True.
Yes.
715, cannot categorize it. True.
True.
I see up here at the top, Power on 120 series, NOP, 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 no trans. Do you see that? I'm sorry. Up here.
Mm-hmm.
Yes, ma'am. What does that mean? If you know.
Don't.
Okay. Now, none of these strips where you can't categorize them are reassuring. True?
You can't comment because you can't categorize, so you don't know.
Well, there's nothing reassuring about a strip you cannot categorize. True?
You don't know that because if there's movement, That could be reassuring. That's why you can't categorize, because the baby's moving so much.
Okay. And if the baby's dead, you wouldn't expect much movement, true?
If, yeah, knowing that information prior to. But with their information they had prior to that event, they would have thought there was a perception of movement, which is what they obviously thought.
Yes, ma'am. 716 cannot categorize, true?
Yes. No.
Okay.
Yes.
All right. 717 cannot categorize, true?
True.
718 cannot categorize, true?
True.
719 cannot categorize, true?
True.
720 cannot categorize, true?
True.
721 cannot categorize, true?
True.
722 cannot categorize, true?
True.
723 cannot categorize, true? 724 cannot categorize, true?
True.
That brings us up, let's see. The last strip for the 21st is 714 or 715, true? Looks like at 715 it picks up at 522, 1205, is that right? Is that right?
What was that question again?
Yes, ma'am. 714 ends May 21st, 2012 at 22:14, true?
Yes.
10:14 that night, right?
Yes.
And the next one is, next strip is May 22nd, 2012, 5:51 the following morning, true?
Yes.
So there are no strips between May 21st, 2012 at 10:14 that night and May 22nd, 2012 at 5:51 the next morning,
That's what it
true?
looks like.
And that's a,
That's what it looks like, true.
so that's no strips for about 8 hours, is that right?
10 to 5 is 7. Mm-hmm. Right, 8 hours, 5:51. Mm-hmm.
Okay.
Yes.
All right. Now, let's see. Sorry, an issue. All right. 37. Looking at 137, that's where we were earlier. According to the chart, at 1622, the fetal heart rate, baseline rate was 130. Variability was minimal with undetectable, less than 5 beats per minute. That's a category 2, true?
Mm-hmm.
And then on the following page, 138, 1630, 1700, and 1730, the nurses still classified the fetal heart monitoring strip as a category 2, not a category 3, true?
That's what it looks like.
Same thing, if you look down 1800, 1830, still classified as a category 2, true?
Yes.
Also indicates here that at 1810, medication comments, AZT 2 grams per kilogram, loading dose, IVPB started, true?
That's what it says.
Yes, ma'am. According to the record, the AZT had been started at 1810, true?
That's what it looks like, yes.
And ideally, you'd like for the AZT to run how long before you take the baby out?
Like an hour is the loading dose, and 3 hours usually, but South Fulton's policy was 4, just to
Okay.
make sure.
So a total of 4 to 5 hours from,
4, yeah, 4 or 5.
okay, 4, which would put you at 10 o'clock that night.
Okay.
Was that right? Is that, since the dose was started at 1810, at, let's see, 19, 20, 21, 22, at 2210, you could have delivered the baby, true?
Yeah, 2210, usually yes.
Okay. I mean, if there were something ominous or urgent, you could deliver it before then, true?
Yeah, or deliver it then at that night, because overnight the staffing is not in any hospital just for you to do just a scheduled C-section. So
Okay.
normally you wouldn't just do that because there may be other emergencies that knock that.
Okay. At 1800, let's see, we're still looking at SFMC 0138. According to the nurse, KDP, do you know who that is?
Can't remember.
Okay. It says difficulty obtaining continuous FHR tracing, DT, and that's due to increased fetal movement, true?
That's what I said, yes.
Okay. Continuing to readjust EFM, right?
Okay.
EFM stands for electronic fetal
Fetal
monitoring,
monitoring.
true?
All right.
And of course, this increased fetal movement, you wouldn't expect that in a dead fetus, true?
Her perception, no.
Okay, so that was the nurse's perception was that there was increased fetal movement at 1800, May 21st, 2012, but the nurse was wrong about that assessment, true?
Once we got in intraoperatively, hindsight, it's always 2020.
Okay. The nurse's note is inaccurate, true?
Object to the form, John.
You may answer.
It's not inaccurate per her perception at that time with the testing and the limitations of the tests.
Okay, but her perception was incorrect, true?
It looks like everybody's perception was incorrect. Dr. Page's
Okay,
and everybody involved.
okay. Then again, the next time they categorize the strip on the next page at 1900, it's again a category 2, true?
Mm-hmm. Yes.
Okay. Now, up until this time, there have been no contractions, right?
Yeah, that's what's recorded, no contractions.
Okay. And the fetal heart rate baseline at this time is 125, is that right?
Yes, that's what's
With no
recorded.
baseline change? Right,
Yes.
okay. Now, let's see. There's a note here at 2000. You said that 2000 or 20?
Oh, right here.
Yeah, 5/21/2012, 20. Not. 8 o'clock in the evening, right?
Yes.
Okay. Nurse at bedside adjusting ultrasound, no baseline change. Annotation, unable to determine, unable to obtain continuous tracing, unable to determine, unable to get a continuous tracing, can't determine accelerations, decelerations, or anything else, true?
Yes.
Okay. Now, you weren't called at that time, true?
I don't remember. Don't
Okay.
recall.
You weren't called back here at 1800 on May 21st, 2012 to say, we can't get a tracing, but the tracings we do have are category 2 or category 3, true?
I don't recall, but I
Okay.
don't think so.
You flip on over to 0140. Looks like at 2000, the AZT is still infusing per pump at 140 milliliters per hour, true?
That's what's recorded.
Okay. And at 1930, again, they've got this a category 2, but in your view, the strip is a category 3, right?
Object to the form. If you want to look back and
Sure.
I don't see category 2.
I know,
Oh, I
but-
see. I'm sorry.
So I'm looking at 1934, 1943, and 1926, which is SFMC QS 0694, 695, and 696. 694, is that a category 2 strip?
It could be difficult to assess because the baseline is not continuous, enough to see if those D cells are those little minimal subtle D cells or something.
Okay. From, let's see, the next one, SFMC QS 0695, which goes up to 1934, which would, of course, cover 1930. Does that look like a Category 2 strip to you?
I don't know if she did some auscultation and just heard the movement and said Category 2, but I can't detect anything because the strip is not there and I wasn't by the bedside, so
Okay.
I can't comment for her because sometimes they can hear and auscultate and it won't record.
Right.
So she could have.
My question to you, though, 0695, is that a Category 1, Category 2, Category 3, or you cannot categorize?
Can't categorize.
Okay. Same thing for 696, Category 1, Category 2, Category 3, cannot categorize.
Can't categorize.
Okay. And back to 694, Category 1, Category 2, Category 3, or cannot categorize.
That could be a Category 3, but it's a short period of time.
Okay.
Should be in Hudson.
And then if you move on to back to SFMC 0140, do you see that?
Yes.
5/21/2012 at 2030. See the fetal heart rate baseline rate there is 120 via Doppler. True? At 2030? Down here.
Oh. Oh, yes.
Okay. And now, fetal heart rate baseline, if it goes from 130 to 120, is it going up or down?
That doesn't have any significance because our heart rate can differ from time to time.
Okay. Thank you, and you answered that question. My question's a little different. Would you read back my question, please, Mr. Court Reporter? One second.
Now, fetal heart rate baseline, it goes from 130 to 120, is it going up or down?
Because 120 is less than 130, that's down.
Thank you. And if you flip on over to 0141, labor and delivery flow sheet, May 21, 2012, it's 2030. It's got a comment here regarding variability, right? It's got minimal, undetectable to less than 5 beats per minute. Annotation, not able to keep continuous tracing long enough to determine variability. Not able to determine accelerations, unable to determine decelerations. Ultrasound lead placed over area where fetal heart rate was picked up with Doppler, still unable to maintain continuous tracings. Do you see that?
Yes.
Did anyone from the hospital call you at 20:30 or 8:30 that evening and let you know about that?
I don't know what time, but they did call me and tell me they couldn't continue, they couldn't get a tracing.
Okay, according to the note, they didn't call you then, right?
I don't know what time they called.
Okay.
Yeah. But they did mention that whenever they called.
Okay. If you flip on over to the next page, 0142, 2009. Patient states she feels fetal movement. Fetal movement is also heard via ultrasound. You see that?
Yes.
Okay. And then at 9:25, so that's an hour and 16 minutes later, reads call page placed to provider. Annotation, Dr. Whyte called and informed of fetal monitoring and lack of accurate tracing. Did you see that?
Mm-hmm.
Yes?
Yes.
Dr. Whyte reported that since tracing was reactive during day shift, to discontinue EFM and let patient rest for the night and replace electronic fetal monitoring at 0600. True?
Yes.
And that's what you told them?
That's what it says there.
Yes, ma'am?
I can't remember that day.
Okay. But any reason to believe this record's inaccurate?
No.
Okay. Now, when you were called at 21:25, no one told you that there had been any Category 3 tracings for that baby, true?
Not if that documentation is correct, because I said reactive.
Okay.
So it wouldn't have been reactive in a Category 3.
Right. And if you look at how they were categorizing, if you look back at 1930 on page 140, they were categorizing the strips as Category 2, right?
Yes.
Okay. Then if you flip on over to 143, at 2100, May 21, 2012, It reads here, patient states feeling a little bit of pain in lower abdominal area. True? You see
I'm
that?
sorry, okay. Oh, mm-hmm.
Yep. Nobody called you and told you about that, right?
Can't recall.
Okay. Does anything in the note indicate that anybody called you about that?
I don't see anything.
Now, if someone had a Category 3 tracing and the patient's starting to feel pain in their lower abdomen, wouldn't you expect someone to notify you of that? Let me answer.
I mean, patients feel pain all the time pregnant. I would look for like a regular kind of pain
Okay.
or discomfort. Like if she regularly felt something, not just a pain.
Well, these are questions that you would ask a nurse if the nurse called you and
Yes,
told you
right.
about the pain, right?
Right.
Because the nurse didn't call you, you have no way of asking the nurse those questions, true? Right? Here in the notes at the bottom of 143, external annotation, monitor off per order Dr. Whyte, all caps. You see that at
Yes.
2200?
Yes.
External no continuous monitoring. Flip over to the next page. Fetal heart rate of 112 to 119. Able to trace with ultrasound for 20-second interval, a fetal heart rate of 112 to 119. True?
Yes.
Is 112 to 119 more or less than 130?
Less, but that means nothing.
Okay. Is 112 to 119 more or less than 120?
Less.
Okay.
Less.
Maternal pulse ox applied to rule out maternal pulse. Maternal pulse running 98. See that?
Within normal.
Yes, ma'am. Well, they took a maternal pulse to make sure that the fetal heart monitor wasn't picking up the mom's heart rate as opposed to the baby's. True?
Yes.
And by doing that, they showed that the fetal heart rate of 112 to 119 was actually the baby's, not the mom's. True?
What they can see from an external. Exactly.
Well, all this is what they can see from an external,
Exactly.
right?
But that doesn't exclude that. That's what I'm trying to say.
Doesn't exclude what?
That there's still some error. There's still a margin of error with the external fetal monitor in terms of trying to detect viability.
So where the medical record says fetal heart rate of 112 to 119, the medical record's in error. True?
I don't know if the
I
I
mean,
don't know if the medical record is in error. I'm just telling you about the measure of error of an external test.
maybe that's not my question. My question, it reads here, fetal heart rate of 112 to 119 at 2130. True?
Yes.
Okay. Is, in your view, that's inaccurate because the baby was already dead. True?
Yes.
Okay. Okay. Now we've got, if you look down here at 2200 or 10 o'clock, you see the pain scale, pain presence, pain type. Pain presence is now constant. True? You see that?
Yes, I do see that.
Pain type is cramping, ache. True?
Yes.
No one from the hospital called to tell you that the patient was now in constant pain with cramping and an ache. True? And that's something you would expect the nurses to call you and let you know about? True.
Yes. Yes.
That's because you're caring for this patient and you're not there. So you're relying on the nurses to tell you what's going on with the patient. True?
True.
Same for the Category 3 strips. True? You may answer.
True.
If you look on over to the next page, SFMC 0145 at 2200.
And that's the same time the pain was noted.
What?
I'm just, the 2200 is the same time the pain was noted. I'm
Correct.
just asking her. Okay,
Correct.
that you called.
Okay. Why don't I ask you, Kevin?
I'd love to.
Was a call made?
Looks like it.
Okay. And who called who?
You can read it.
I'm sorry. At May 21, 2012, at 2200, 10 o'clock, call page placed to provider. Dr. Whyte called again, informed of present inability to trace fetal heart tones. You see that? Yes, ma'am?
I do.
Okay, and you were called at that time?
That's what it says. I can't recall what
Okay.
really happened.
According to the note, they told you 4 nurses attempted over the last hour Also
I
informed that,
remember that.
I'm sorry, I didn't mean.
Yes, I remember that.
Also informed that patient is now contracting Q3-4 minutes, requested orders for mainline IVF rate with AZT medication infusing at 140 milliliters per hour. True?
True that I knew about the contractions?
True that this is what you were told on the telephone?
I can't recall.
Okay. Any reason to believe that this portion of the hospital record is inaccurate or untruthful?
I don't remember.
Okay.
I don't think-
I'm not asking about your memory. I'm asking you whether there's any reason for you to believe that this portion of the medical record is somehow inaccurate or untruthful.
I know if I knew she was contracting, I would have come in, so I didn't really know.
Okay. So the portion here where it indicates that you were told that the patient was contracting 3 to 4, every 3 to 4 minutes, that's not true. True?
I don't recall.
But if you were told that the patient was contracting every 3 to 4 minutes, you would have gone to the hospital. True?
Yes.
Okay. And that's because based on what Dr. Page shared with you and what you knew about the patient, with that additional knowledge, it would be time to go to the hospital and get the baby out. True? Yes. Also, there's nothing here that indicates that you were told about the Category 3 strips even still. True?
I don't recall, but I don't see anything in there.
Okay. Medical records we talked about, it's important to make them accurate. True?
Yes.
Document what's done and what's not done. True?
Yes.
And it's important, have you ever heard the phrase, not documented means not done? Yes?
Yes.
And we talked about why it's important to keep accurate medical records. True?
Yes.
Nothing here indicates that you were informed that Angel Milan had Category 3 strips since she got to the hospital that day. True?
Check to the form.
You may answer.
Don't.
But if someone had told you that there were Category 3 strips and we can't keep the monitor on and now she's contracting every 3 to 4 minutes, you would have absolutely gone directly to the hospital. True? Yes? And you would have been there within 20 minutes. True?
Yes.
All right. If you flip on over to the next page, which is 146, we've got pain scale, pain presence, pain scale 3, 4, 5, pain present, constant, constant, constant. So for the next, this is like 2 hours, the pain is actually increasing. It's going from 3 to 5, true?
Yes.
Pain of 3 to 5 is going up, right? Increased pain, true?
Yes.
And the pain present is constant, true?
Yes, which doesn't sound like a contraction if it's constant.
It also indicates that the pain type is, it's now sharp and stabbing, true?
Yes.
No one from South Flint Medical Center called you to tell you that the pain was now constant, the level of pain was increasing, or that the pain was now sharp and stabbing, true? True?
I don't remember.
Okay. If you'd been told that, as well as the patient was now contracting, as well as, there were the fetal heart strips that they were able to get were Category 3, you would have most assuredly gone to the hospital and gotten the baby out, true?
I think down here it says she didn't feel any more contractions. That was at 1 in the morning, 1:03. I guess, did they IV bolus her or something? Because she didn't feel any more after a while.
Yes, ma'am, but my question's a little
Oh.
different. Do you mind reading back my question, please, Mr. Court Porter? Any-
We've been told that as well as the patient was now contracting, as well as, there were the fetal heart strips that they were able to get were now category 3. You most assuredly would have gone to the hospital, right? True?
True.
Okay. Let's see. You mentioned earlier that there were 2 cases that you seem to remember where there were 2 babies that were already dead but still had fetal heart monitoring tracings. Do you recall how it was determined that those babies were dead prior to delivery?
Oh, not totally, but I remember in residency it was stated that they were dead for some time. There were actually 2 cases like that.
Yes, ma'am.
And they were dead for at least within 24, at least close to 24 hours or over.
Okay.
Not
But-
like this case. This one looked longer.
Yes, ma'am. This one's 3 days plus, right?
That's what it looked like.
Yes, ma'am. Here, 522.12, we're now at SFMC 0147. Do you see it's now 4 o'clock in the morning? Order for no continuous EFM. You didn't give any more orders for electronic fetal monitoring, true?
No.
Okay. All right. Let's see. If you would, flip to, can I get one more of these? Thank you. SFMC 0026, you see that? I'm going to mark that as 10.13.
What is that, so we can find it?
I think it's her discharge summary. See that?
I can use this one.
Sure.
Yeah.
See is about
Yeah.
Here it is. I found it.
Oh, okay.
Oh, we'll sort this out.
Okay.
I don't know how to.
Okay.
What's the number, Jim?
0026.
26.
I think it was up there. Yeah, you had it.
All right, this is your note, true?
Yes.
Okay, and that's your signature at the bottom right?
Yes. Mhm.
And that's again, not dated, true?
Yes.
And it's untimed?
Yes.
Do you remember when you prepared this note?
No, but I know when it goes to the medical records, we have to come back and verify it if it's not dated or not timed. So we would have done that. You know how you saw the edited?
Yes, ma'am. Yes, ma'am.
Yes, so that would have been taken care of.
Okay. So this is the obstetric discharge summary you prepared for Angel Mylan for May 21st, 2012, true?
True.
And this is your handwriting, your signature.
True.
And up in the upper, you've got IUP, and you've got 36, 6, 7 weeks, is that right?
Yes, that's what's
So she was 36 weeks, 6 days gestation, right?
Yes.
And the admission was May 21st, 2012, right?
Yes.
And she was admitted for non-reassuring fetal heart rate status, right?
Right.
So when she was admitted, before you spoke with any of the nurses, you already knew that her fetal heart tracings were non-reassuring, true?
Right.
And immediately beneath this note, you've got obstetric complications admitted by, what is that? Is that Dr. Page, mean?
APA.
Oh, Dr. Page, yeah, APA.
Okay. Admitted
Dr.
by
Page.
Atlanta Perinatal
Yeah,
Associates?
associates, uh-huh.
So Dr. Page admitted her.
I can't recall.
Okay.
Yeah, he may have just sent her over there and they called me. I don't know.
I think that it's got you in the admit record.
Yeah, they'll
Commissioner.
call me once he sends them over.
So they were admitted under your care.
Okay, right.
Dr. Page for negative Dopplers and BPP of 6/10, right?
Right.
Then under newborn data, female fetal demise, right?
Yes.
Sadly.
Yes.
Then your next one, history and physical, that's 0028. I think we already marked that. That's
Okay.
10.1.
Mhm.
Yes, ma'am. It reads here that Dr. Page, a perinatologist, and I spoke on the phone,
Mhm.
right? And you've told me everything you recall about that conversation, right?
Yes.
Presented after being sent from APP for evaluation and delivery. And APA that's Dr. Page, right?
Yes.
His group, right?
Mhm.
Yes.
Yes.
Because of negative Dopplers seen at the perinatology office that day, period. Patient currently is 36.67 weeks, and Dr. Page, the perinatologist, and I spoke on the phone and concurred. That means you agreed with Dr. Page, right?
Right.
That delivery needed to be done via cesarean section and not to attempt vaginal as the AZT intrapartum therapy that will be followed soon after by delivery. True?
Yes.
Patient was noted in the report submitted by Dr. Page from the perinatology office to have a biophysical profile of 6/10, right?
Yes.
That's what he shared with you on the phone. You also saw it in the report, right?
Well, I don't know what he shared over the phone, but yeah, he looks like he did.
Okay. And echogenic bowel was seen from the baby, and otherwise
Wow.
just negative Dopplers.
I'm sorry. Going back, it
Sure.
just says that I obtained that information, but it doesn't say from the phone, so I'm not sure. I can't recall.
But you got,
Because this is once I look at all the paperwork and I
Right.
gathered it together and then dictated this.
but you got Dr. Page's recommendations on May 21st, 2012. True?
Yes, I
Okay.
believe so.
And the past history, you've got the things we've talked about: HIV, diabetes class C, late prenatal care, 2 visits to Grady, 29 weeks gestation, right? Social history, family history, current medications. And then you've got down at the bottom the review of systems, right?
Mhm.
And what you've written here, what's included, significant for once the patient admitted after the findings of APA, and that's Dr. Page, right?
Mhm.
Yes?
Yes.
That she felt no fetal movement for 3 to 4 days. Is that right?
Yes.
Which indicated to you that the baby had been dead for 3 to 4 days when you saw her on the 22nd, the morning of the 22nd. True?
Repeat the question.
Sure. Do you mind reading that back? Thank you.
Which indicated to you that the baby had been dead for 3 to 4 days when you saw her on the 22nd, the morning of the 22nd, true?
The fact that she said she didn't feel fetal movement, that indicated that to me? That she told me she
Yes,
didn't
ma'am.
feel it? No, because just like you saw on the 27th of April, she didn't feel fetal movement and the baby was fine. So that didn't indicate that to me. No, that's my answer.
Okay. You based your, well, what did you base your finding on that on the morning of the 22nd, the baby had been dead for 3 to 4 days
After the surgery or before?
after the surgery?
Oh, after the surgery.
Yes, ma'am.
Besides the findings intraoperatively?
Yes, ma'am.
Yeah, and then her history that changed and appeared to be more forthright, that.
Okay. And the forthright part was when she said she hadn't felt movement for 3 to 4 days. Is that right?
Well, because it went along with the findings. That was the one congruent thing in her whole history.
Okay. Anything else? No?
No.
Okay. I know we know. I can see you shake your head, but he can't
Oh, no.
take that down. Physical examination. Now, that was not done on May 21st, 2012. True? You've got up here physical examination.
Not that I recall.
Well, you didn't see her on May 21st, right?
And I didn't recall, so I'm not sure. I may have come in there at some point. I don't know. I don't remember.
Okay. If you'd been there, wouldn't the notes indicate that?
This may be the note that indicates it.
Okay. So you think now maybe you did go in on May 21st, 2012 and examine the patient?
Before all the monitoring and everything, probably. I'm not sure. Because a lot of times we'll run by, but I don't remember. I just know I've done that before, and physicians will do that. If they're in the area, they'll just stop by and say hi while the patient's outside waiting to go in a room. And then when she goes in the room, we may do an initial evaluation before she even gets on the monitor and stuff.
Okay.
So I don't recall.
Okay. Do you have Angels at Depot? On admission, was unrevealing for anything remarkable, and it was unremarkable. And the plan was then, after the assessment was made, to admit the patient for PIH labs as recommended by Dr. Page, right?
Yes.
So you were following Dr. Page's recommendations, true?
Check before.
Perinatologist and labs to prepare for cesarean and AZT intravenously to be ordered and run for 3 to 4 hours prior to the section, true?
Yes.
Okay, and that was the plan based on your physical examination, true?
No, that's the plan based on
What Dr. Page
Page
recommendations, got it.
Now, sometimes we'll follow, once we evaluate the patient, we may change some of the recommendations.
Okay, but not in this case.
I don't remember doing that.
Okay. Assessment, you mean Angel Mallon, was 36 weeks, 6 days, gestation, HIV positive, uncontrolled diabetes, non-compliance with treatment regimens, with poor prenatal care and late prenatal care, true?
Mm-hmm. Yes.
Immediately beneath that, on admission, the charge nurse stated that the baby's strip looked reassuring, true?
Yes.
Do you remember what charge nurse that was?
Bridget?
Bridget? Okay. And Bridget told you Angel Mallon's strips looked reassuring, true?
Yes.
Okay. And she also said there were no signs or symptoms to deliver the baby without the ACT, true?
At that time, yeah, that was just around 3 o'clock or so. Yeah.
Okay.
3 or 4.
And secondary to any ominous signs on her assessment, true?
Right.
In other words, there were no ominous signs, right? Then looking over the next page, 0030, that's your update for history and physical. I believe we looked at this earlier today. That's you signed that.
Yes.
Didn't date or time it, true?
Yes.
Dr. Page's report would have been attached to that initially, right?
Yes.
Let's see.
Well,
Go ahead. Yep.
I'm not sure if it was attached.
Okay.
Because, yeah,
It just, you wrote that
at some point he sent it over. I'm not sure when. Yeah.
when you had the physical copy.
Right.
And now I want to mark SFMC 0031 is 10.14. That's the autopsy report, right?
That's what it looks like.
Have you looked at that before?
I'm sure I did, yeah.
Okay, and that indicates that the baby was more or less normal, true?
Technical form.
We'll go through it.
The skin
Sorry.
slippage is kind of, I'm wondering what terminology is being used there and what is that?
Got it.
As we go into this autopsy, can we take a quick break?
Sure.
Let's run.
Autopsy, we're 4 o'clock.
We are off an hour and 4 o'clock.
Oh.